Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today topic is common medical billing mistakes in our healthcare domain. Guys, before we discuss about this topic, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and turn on the bell icon so that you will get every hour video as a notifications to your mobile or your desktop. Guys, now we are discussing about common medical billing mistakes. The first one I mentioned here is very common mistake is untimely filing. So, what happened? The patient taken service from the doctor on particular date, right? That will be known as a date of service. So, after the patient got services from the doctor's billing office or doctor's side, they submitted claim after some time. For example, today patient was visited doctor, but they submitted after 6 months or after 3 months. After some time period, the doctor was delayed to submit that medical claim to the insurance within the time. At the time, insurance is they are telling that we are not giving any payment to this claim because you are not submitted the claims within the time frames. So that will be known as a untimely filings. So we have to, doctors need to submit the medical claims within the time frame to the insurance. So if they are not submitted within the time frame, insurance will not give any payments to the doctor. They are clearly telling that these claims are denied as a untimely filings. So the most common is untimely filing is also one of the billing mistakes because the billers will not submitted the claims within the time frame to the insurance companies. So that is what untimely filing is one of the common medical billing mistake. And guys, now we are discussing about common one of the medical billing mistake is medical coding errors. See, yeah, we know that in RCM cycle system there is a transcriptionist, medical coders, AR callers, and also payment posting people. All these people are working together to getting the payments to the doctors. In that, we have a very crucial, very important role is for medical coders. Why? Because whatever uh, patient symptoms of that disease and whatever the provider given services to the patient, the treatment procedures, all this will be entered into a numerical parts, digits, right? Like for example, CPT is a 5-digit code and the diagnosis code is also like in different format. So these all formats, the diagnosis codes and procedure codes, CPT codes, and the place of services, modifiers, and the frequency, everything will be this service related items will be decided and coded by the coding department. For example, if they are not given appropriate coding to the services, and if the on behalf of doctors there is a billing team, right, they are submitted the claim to insurance. At the time insurance is not giving payment to the doctor, they will tell that they will deny the claim with the reason whatever the diagnosis code, procedure codes are not valid or they are not compatible to each other, or otherwise the patient age and the diagnosis whatever we build is does not match to this thing. So these all are like mistakes from coding department. So if there is a no appropriate coding is available or if they are not doing accurate coding job, then our insurances deny the payments to the doctors. So here we have to understand that we have to submit a claim from a billing department to the insurance offices with accurate coding. So if you are not having correct service details, here service means we can like diagnosis, CPT, place of service, modifier, this kind of things will be coming to the coding related things. We have to understand this point. So one of the major and also common medical billing mistake is also coding department errors also will be comes into the picture. Okay guys, now we will discuss about one more common medical billing mistake: duplicate billing. You know, yeah, claim is billed twice to the insurance companies. Initially, it was billed and it was processed and paid, for example, by the insurance. But doctor not verified. Again, he was submitted the claim to insurance, or on behalf of doctors group, they are submitted again the claim to insurance companies. At the time, insurance will again they will acknowledge the claim and again they will process the claim. Again, they will finalize that it was denied because this claim was already paid to a doctor previously. Again it was billed, just re I mean submission, claim was resubmitted twice. That is also duplicate scenario. I mean duplicate billing will be leads. And sometimes what happen, whatever the billed services are also similar to the previously billed claim, at the time also they will deny as a duplicate. So like that, insurance is not providing based on duplicate billing. We have to keep understand that while submitting claim, you should have to verify whether this claim already filed to the insurance on behalf of our billing team or not. I mean on behalf of our doctor side or not. So that is one of the checklist we should have to verify uh, before submitting claims to insurance companies. Guys, one of the common medical billing mistakes is not obtaining prior authorization. We know very well, right? Before doctor giving services to the patient, the doctor should have to get that kind of service providing approval from the insurance companies before service is given to the patient. That is known as a prior authorization. Means in prior, the doctor need to get the authorization from the, I mean approval, authorization of approval from the insurances. So if the doctor is not obtained that prior authorization approval from the insurance, but the patient came to doctor and uh, I mean doctor provided the services to the patient, then doctor submitted that medical claim form to the insurance companies without authorization. Then insurance obviously, if they want authorization, they will deny the claim because the doctor is not submitted the authorization. That kind of services level of care of that kind of service is required authorization, but doctor not submitted, right? So that is the mistake which is done by the doctor because doctor is not obtained the authorization, I mean prior authorization. So this also leads to billing mistakes. So for example, I am telling that once doctor given services to the patient and that claim submitted to the insurance, now insurance is denied the claim stating that authorization is required. At the time doctor realized that okay, we have to submit the authorization for this kind of services, then doctor will process to obtain the authorization after services billed to the insurance. That is called as a retro authorization. For example, before service to the patient, doctor need to get approvals for kind of services before services, I mean before billing claims to insurance, before giving services to the patient. That kind is known as a prior authorization. So here prior authorization, obviously they will get it from the insurance as a approval. If doctor is not taking approval, obviously that will be uh, that is a billing mistake because that kind of service is required. If not, that is a mistake. So these are the common mistakes if the doctor is not obtaining prior authorization. And guys, one more billing mistake I provided: not performing insurance eligibility verification upfront. See, if you are submitting any claims to insurances, before that we should have to check whether the policy is active or not. For example, patient is not giving premiums to the insurance regularly, then obviously nothing but policy was inactive, right, or not active for that particular service dates. So it is our job to find out verification on that particular policy. whether the policy is active on that particular date of services or not before submitting claims to insurances companies. What happened, because you are not verifying your insurances, your submitted claim, and after processing time they will acknowledge and they will process the claim and they will tell that it was denied because policy was inactive on that particular date of services. So it is our job, before submitting any claims to insurances, we should have to verify the policy is active or not. You should have to verify your eligibility details. Then see, if you are habituated to run eligibility on this kind of scenarios, related to eligibility scenarios, it is a better, I mean, you will understand whether all details like checklist like member id is correct or not, and date of birth is correct or not, and policy especially is active or not on a date of service. This all kind of things will be coming by the running eligibility. So it is also comes under a billing mistakes, because insurance is not process the claims if policy is inactive, right? So there is a very common medical billing mistake if you are not performing your insurance eligibility verification at the before you are submitting claims to insurances. And guys, here I given one of the billing mistake. Common one is failure uh, to adhere here to payer guidelines, nothing but insurance guidelines. So they, we have to understand that every insurance have their own guidelines. For example, traditional Medicare have their own CMS guidelines, and managed care of that Medicare Advantage plans, they will follow their like MAC guideline, I mean their respective guidelines, right? And also BCBS also follow their own BCBS own guidelines, policy guidelines. As example, Avalon guidelines of BCBS, and also like insurances uh, will follow their own guidelines before submitting claims to the insurance companies. Billing team should have to aware that this kind of services are not billed to insurances, or this kind of services will be billed to insurances based on policy of that particular patient, or because under few policy guidelines some of the services will be covered, some of the services not covered based on some kind of policy. For example, we already know that ABN services, I mean advanced beneficiary notice of a non-covered services for the Medicare beneficiaries, right? So Medicare clearly telling to the patients that these are the services not covered by Medicare, and at that time the patient will also acknowledged by signature that okay, we will not get payments for this kind of services if I am going to the doctors. That will be already that consent, that signature also given by the patient to the insurances. But doctor again, we are billing or not, that kind of things we are verifying or not, or we are we are follow to guidelines or not. These all things will be need to verify before submitting claims to the insurance companies. If you are not verifying, mostly they will deny the claim, or they will reject the claim for the that kind of vital information which is related to guidelines. Guys, one of medical billing mistake is also missing documentation. If you are submitting claims to the insurance companies, it is a better to submit uh, other insurances UOBs, especially while submitting claims to secondary insurances. You should have to submit at the first time only along with the primary UOB. And also if you are working for co-op scenarios, and there is a less time filing limit is, for example, you already have only 1 month to submit the claims to insurances, but there is a conflict between the two insurances at the time, who is like primary, we are unable to get that information, right? So that related to COB information, so it's COB scenarios, coordination of benefits. So at that time it is a better to submit insurances along with other insurances COB details. Like there are two insurances to the patient, they are telling that we are not sure who is primary. At that time, it is better to submit a claim to insurances along with that COB information, because here clearly they will process the claims based on that other documentations, and also some other supporting documents like consents and accidental injury forms, accidental details, signature forms. These all kind of things will be necessary before submitting claims to insurances. These documents are necessary. So like this missing documentation is also one of the common like medical billing mistakes. So it is our mistakes. So it is a better to check twice. Billing team need to check the twice before submitting claims to insurances if any necessary documents are missing or attached. So in that way, we should have to find out our checklist, and we should have to ensure that all supporting documents are attached. Hello guys. Here, one of a common medical billing mistake is nothing but not following upon unpaid claims. See, already claims submitted to the insurance on behalf of billing team. On behalf of doctor's billing team. Insurance is process the claim, and they will deny the claim with so and so reason. They are denying reason stating like any other example, timely filing scenario, or otherwise they are deny the claim due to medical coding issues. But here, for example, AR caller people are not doing follow up on a that unpaid claim why it was not paid. So if claim is not paid, it will be review, right? Why it was not paid, what is the denial reason. So based on that denial reason, the claim supervisors need to work accordingly. So like why it was not paid, so what kind of potential cause on that particular unpaid claim, and what is the resolution for that, what kind of solutions we need to bring for that particular problem. And they have to do this kind of things on that particular unpaid claim. But if they are not touching that claim, if they are not follow on that unpaid claims, that will be also mistakes from our medical department, right? So that will be not giving, end of the day we lose our timely filing limits, and there are no time frames to prove that okay, it was my mistake at the earlier time, but now we are correcting, but there is no time frame to tell to insurance. So that is what it is our mistake if you are not doing follow-ups regularly on our unpaid claims. So if there is any unpaid claim, we should have to ensure that why it was not unpaid. On priority, we should have to make it work on those claims. But here common thing is we are not following up a unpaid claims, that will be loss of payment to the doctors from the insurance companies. So this is also one of the common medical mistakes I can consider. So guys, if you felt content is useful, could you please like our video so that it will reaches many more needy people who are looking this kind of content. It will reaches them easily. So that is I am expecting a small help from you. And also if you uh, would like to share this content to your friends, also please share it. And again, really thank you so much for your time, for your valuable time, and have a good health. Bye for now.